welcome. So today we are going to go through another case study, so which is saying start the image below and answer the subsequent questions. So we have this machine here. So the question A is saying what is the name of the equipment shown, and then B is saying what is the indication for using this equipment, then what mechanism does it use, then D list four complications of using the equipment, then E briefly describe how it works. So we are done. So let's go ahead with the answers. So the name of this equipment, which is shown here, that's a phototherapy machine. So that's the equipment shown, that's the phototherapy machine. Then the indications for using this equipment, we have unconjugated hyperbilirubinemia, but the question is saying what's the indication, so that's all we are going to put, but that's not the only one. Then what mechanisms does it use? So this machine, so we are now on mechanism. So this machine uses a light of a specific wavelength of 420 to 460 millimeters range to cause three things. So it's going to cause it's going to use these three mechanisms in short. So the three mechanisms are photooxidation, photoisomerization, structural isomerization. So there is photooxidation, photoisomerization, structural isomerization. Then we are done on this mechanism. What mechanism does it use? And then we can have at least four complications of using the equipment. So four complications of using the equipment. So four complications we can have, or the complications when I'm using this equipment for too long. We can have bronze baby syndrome, we can have diarrhea and dehydration, we can have hypothermia, we can have retinal damage, we can have potential genetic damage. Then if maybe the baby is not covered on the genitalia, you can also cause some damage there as well. So those are some of the things. Then briefly describe how it works. So like we said on the, so we are now on E. So briefly describe how it works. So like I said earlier, it uses a blue light with wavelengths of 450 to 500 nanometers, depending on the literature. These numbers usually changes. So, but 450 is more. That's more. It's usually there. So, but other people give you a range, say 450 to 500, 420 to 460. But they just give ranges. So it uses that wavelength. So for photoisomerization, so when we are dealing with photoisomerization, then it's going to create water-soluble photoisomers of indirect bilirubin through polar configuration of isomer, meaning the Z and E bilirubin, and structural isomers where we have lumirubilin plus photooxidation. So that's what it's going to do. So it's just going to create water-soluble photoisomers of indirect bilirubin. So that's how it works, to be specific. Okay. And then the other things maybe they might ask on this question is that maybe they can ask one contraindication. So one contraindication you can put is conjugated hyperbilirubinemia. Remember we said it is indicated in unconjugated. So contraindication you can put conjugated hyperbilirubinemia. Then precautions. So if they ask you precautions you are going to undertake when using the equipment, one, we have to check the blood sugar at regular intervals. Then the other precaution is you have to encourage breastfeeding. Then the other precaution, you have to maintain room temperature at about 30 degrees Celsius. Then the infant should be naked. However, you have to cover the genitalia and the eyes. So even as we can see, even in the picture here, so that's the eyes are covered. Then here the baby has a diaper, so meaning the genitalia is also covered. So the baby should be naked, however, has to cover the eyes and the genitalia part. Okay, so we are done with the questions, and thank you for watching, and please subscribe and make sure you like this video.